So when it comes to a master healer, a lot of my training, a lot of my mentors in chiropractic made a big to-do about the fact that we don't heal. They would say, I'm not a healer, I don't heal the body, and so forth. In fact, Victor would often say the power that made the body heals the body. And in my experience, that's not accurate at all. I don't find that the power that made the body heals the body. I do find that we are healers. Now, perhaps to understand my perspective on this, it would help you to understand I see repair of the body and healing of the body as two very distinct things. And I see the body as being self-repairing. Thanks. I see the body as being self-repairing. I do not see the body as self-healing. So I was skateboarding with Brett Butterfield the other day in the skate park, and I fell and injured my knee, and my body is in the process of repairing my knee. However, my body has been in the process of repairing my knee for over 10 years because I keep re-aggravating the same knee in the same spot over and over and over again. And in the last 6 months to 7 months, it's gotten to the point where it's basically shut down my daily activities at times. I have barely been able to get up and down the stairs in my house. It's gotten so acute, either from running, hiking, skateboarding. And so I've been working at getting my knee pain-free, in essence, and fully flexible so I can do the activities that I want to do. And I've yet to fully succeed at that. All the efforts that I've made have gotten me so far, and then it cycles back. And it cycles back, the body will repair. Megan does some work, other people do some work. And it's been a little disheartening to me and frustrating to me, as you know, that I'm increasing my distances in running. I like to be really physically active. So I want a knee that works. And the other morning, I woke up and Brett Butterfield was here in town, and we were going to go on a hike. And I said, Brett, we're not going to be able to go on this hike with my knee in the condition it is, because I had injured it the day before, also at the skate park, skating with my son Taylor. And I barely made it down the stairs with putting all my weight on the railing. I was able to get downstairs, but that was it. I couldn't even walk. And we had a hike planned. He'd flown in a day early so we could go on this hike. And I said, Brett, with all of my patients, zero exceptions, I got every one of my patients' knees totally solid. And I generally did it in one visit. And I generally did it only with the TBM knee technique, the knee and gallbladder technique. I said I'd have them touch their knee, their arm would go weak, I'd touch gallbladder, it would go strong, I'd maintain contact and correct T4. And then I would have them stress the knee, and I'd repeat it until they were doing deep knee bends on one knee. And I said, I don't know why that isn't fully engaging when Megan and I are working, and why we're finding to do other things and it's not quite getting there. I said, but I'm looking for someone who has the confidence that it will just make that work so we can go on our hike right now. I said, are you in? He said, yes, let's go. So within about 10 minutes, I was doing deep knee bends, single leg deep knee bends on my left knee. And so we went on a hike. Well, part of the way through the hike, my knee started to hurt again. So he would do some work on me. And I could go like another mile or so, then it would start to hurt again. I got through the hike. It included scaling up some rock faces and things like that. So my knee actually did did quite well overall. And then we went skateboarding the next day, and I re-injured it, and more severely than I ever have, actually. And I came back, and the night before Ed Faust, some of you, most of you have met Ed. He's down in Melbourne. He's an instructor, and he was here to do his team teach for Module 3. And he said, Kevin, I'm pretty effective with knees. He said, will you let me have a go at your knee? And yes, of course. My knee is the size of a football after the fall. And so he began to work on me, and within just a few minutes, he went straight to an emotional state called frustration. And then he tested, where's this frustration coming from? And he got that it was coming from business. As soon as he said that, my knee has been at the forefront of my physical complaints ever since we moved to Las Vegas. And another thing, ever since we've moved to Las Vegas, is that Brett and Megan and I are living together here, and we have the company under our roof here. And there has been, with Brett being at the presidency, not having the experiences, the institutional memory, the experiences of running a business for 30 years like I have. I started my own company at age 16 and have ran companies since then. There's been a learning curve in getting Brett into that place, plus there's the dynamic of father to son and etc. And quite frankly, it's really been challenging for me. And I've been a little more on edge in my life, and it's been something I haven't completely resolved. And sometimes I'll interact with Brett in a way that I am ashamed of, that I regret. It's overly harsh, or it's overly critical. And so I contemplate it afterwards, and I'm working on making course corrections, but I've never really, and even to this moment, I'd say I haven't completely tackled it. And that's not acceptable. That's not a high level of vibration. That's not efficient. That's not maximally gifting and productive. That's not compassionate to Brett. That's not compassionate to anyone who's around me. For me to have this inner turmoil and working to find a place of peace with Brett running the company, and with me supervising him and mentoring him and supporting him in that. And Ed Faust went straight to that within just minutes, that's where this is all coming from. That's where your knee is coming from. And I just instantly, when he said that, I realized that he was spot on. And what we were doing, Megan and I, and Brett Butterfield and I, is we were dealing with the downstream effects. And we would clear out the downstream effects, and I would have some improvement. But then it would all recreate, because the knee issue, the symptom, going back to Victor's comment that symptoms are the language of the body, the symptom, and Gary Acevedo's comment that all pain is asking for a correction, the correction that my knee was asking for was not the TBM knee gallbladder correction. It was not the Kevin Heron knee adjustment and rehabilitative techniques. It was not glucosamine chondroitin. It was not water. It was not calcium. It was not rest. What my knee was asking for was for me to heal the part of me that is experiencing frustration and interacting with Brett and observing Brett and presiding over the company TBM. That's what my knee was asking for. And Ed got there straight away. He addressed that. He went to that emotional component. He cleared that out, and then he started doing some other mess cleanup after that. Also had Aaron Corpelli. I was here that day. He did some other cleanup on that, doing some of this AK evaluation and muscle activation and so forth. Anyway, if you look at the diamond here, I'll just review. This is what we this taught in Module 4. At the top of the diamond is a symptom. At the bottom of the diamond is the ultimate cause. This line here delineates the physical or manifest realm from the energetic or occult realm, the hidden realm. And we start with the symptom, and backward thinking is a process of getting to the ultimate cause that's in the occult or energetic realm. So Megan and Brett would kind of dip in through here and we'd clear things out, but because this wasn't addressed, the pathway would recreate and the symptom would occur over again. So a therapist only works in the manifest realm. So adjusting my knee, doing rehab, taking nutritional support for a knee and things like that, that's therapy. Healing is going into the energetic realm and doing some work down, like here, the TBM gallbladder technique, maybe some emotional work, and so forth. So a therapist doesn't ever get to ultimate cause. Kind of by definition, they're only looking for physical ultimate causes. They're not holistic in their approach. Whereas a healer, which means whole, to heal is to make whole, we are looking to get here. So a healer is someone who will eventually get here. Because healing can only happen once this point has been reached. So now I define a healer as someone who can interact with the patient and get all the way to the bottom of this diamond and release the energy, the discordant energy that's producing the discord throughout the body, manifesting in a symptom, and restoring harmony at this point, which will then produce harmony throughout the body and resolve the symptom. I see a master healer differentiating between a therapist and a healer. Now I'm making a differentiation between a healer, someone who can get down here eventually, to a master healer. A master healer is someone who can get here virtually immediately, straight away. They have a system. Ed used a symptom. He used his own intuition. He used his menuing system. He menued quickly to that point. And one of the things that it takes to go to the bottom of the diamond is some boldness. The willingness to go where angels fear to tread, if you will. Because it is going to rock the patient's world when you get there. Life will never be the same for them. It's especially if it's a bigger chronic recurring issue like my knee has been. It's not going to be, brush your teeth facing south versus facing north. It's not going to be something just kind of minor. It's going to shift their whole pattern in their life. And so to go there, we have to be willing to go there. We have to have set the stage really to go there. Setting the stage is bringing a person to choice. And so Ed asked me, he said, Kevin, quite effective at knees. Would you be interested in having me work with your knees? So he set the stage by bringing me to choice, which is something I always did with patients. I always had a conversation before I even began care about where we were going with our patients and making sure they were in choice with that journey. We do that at the seminars with the orange dot. When someone puts that on their name badge, they're saying, I choose in to you. If you see some points at the bottom of my diamond that comes out while I'm here a student at your seminar, I want to know about them. Anything that will shift my life in a positive direction, I want to know about it. Versus those who don't use an orange dot, they're basically saying, stay above this horizontal line, stay in the physical realm, observe my technique and things like that, make sure I'm doing that properly. So that's one of the key elements is bringing someone to choice. So just to review, healing is a process of tracing a symptom to its deepest energetic cause, bringing harmony where there is discord. So then sometimes that's all you have to do. Sometimes symptoms gone. Sometimes, like you see on all these lines here, there's little nodes, little points along the way. Sometimes there's cleanup that has to be done. So it may not just be that deep correction. We might have to do an adjustment. We might have to do some nutritional support. There might be some rest, some rehabilitation, or what have you. But now the cleanup will work. It will last. The body will be able to complete the repair, and it will be a permanent repair. TBM is not necessarily the only system of healing that will get there. There might be thousands out there. I don't know. I know TBM, and I know that in TBM you can get there very, very quickly. There might be other ways that are even quicker. But the thing about TBM, even if there are other ways that are quicker, is that TBM is both teachable and learnable. So the process of becoming a master healer can be tremendously facilitated by becoming a master TBM provider. Getting comfortable and familiar enough and to have a level of proficiency, memorization of points and corrections and techniques and things like that, where one can get with the patient and go into a trance state and relax and listen. As Victor said, get educated out of mind and let innate guide your hands. Then we can quickly move. But if we're constantly having to look things up, if we aren't familiar with the whole curriculum and how it all interplays, that can get in the way of that. So I see it requires proficiency as well as being in a grounded, relaxed, fully present, not thinking about what's going on at the front desk or back home or in another country having turmoil, but present time consciousness is another really key ingredient, and TBM will get us there if we devote ourselves. So when we look at these types of things, I say to myself, how dare I just fix knees or elbows or low back pain when people hurt in these deep ways? And I think Ed gets it. How dare he just do therapy on my knee when Kevin has a discord that's affecting his relationship with his son, his relationship with others that are close to him. It's affecting the forward movement of TBM as a company and what TBM can give. And so my first challenge to you is to become a healer. If you're not already, become a healer. Get to be bold enough to go where angels fear to tread, and get to that bottom discord that's holding this whole pattern of disharmony that's producing the pain and the suffering in the person's life. Second, my challenge is to become a master healer. Learn to do that quickly. So in a 10-minute conversation with a patient, or 5 minutes having their arm and manualing and testing, you can quickly get there, resolve that discord, and then see what cleanup, if any, is needed. What we need, plain and simple, are more master healers on this planet. You also recall on this chart that we in TBM are committed to seeing that there's a well-trained, compassionate healer within reach of every human being. And that is what I'm devoting my life to. I want to leverage everything that I am, everything that I know, all the resources that come into my ability to manage and leverage and utilize, towards seeing that every last human being on this planet has a healer, at least, and preferably a master healer within reach of them.